sent you Dr. Gino and fall and head injuries and other things.
Hello, everybody.
Crank it up.
Hi, everybody.
Hello.
So, Debbie asked me to do a small presentation on falls and basically the assessment that you have to do after somebody falls. So first of all, disclaimer, I'm not really an expert in this topic because this is rarely something that we see on our regular basis in the offices. So anyway, I did some reading up on it and I learned some new things. And I'm sure you guys see a lot more of this than I do, and hopefully I can learn some things from you. So the definition of a fall is that it's an event which results in a person coming to rest at a lower level than what they started off with. So if somebody tries to get up from a chair and just falls right back when they didn't want to, that would be considered a fall. Now it excludes certain things. So if there was an earthquake and we all fell down, that would not be considered a medical fall. Or if somebody comes and bumps into you, or you have a car accident, or you get pushed over by somebody and you fall, that's not considered a medical fall. Also, usually the definition of a fall is most of the time without loss of consciousness. If somebody loses consciousness, that kind of falls under a different category. We can get out of this. Go to the dot. So I was very surprised. I mean, I had an idea, but the cost of falls in the United States is about $50 billion annually. $29 billion is usually spent by Medicare, $12 billion is out of the pocket, and then there's $9 billion which is billed to Medicaid. So these are very common. They happen in 1 in 4 in individuals who are above the age of 65. So it's actually a lot bigger problem than what it seems. I was also reading up at a place and they said that it's actually the 5th or 6th leading cause of death in the United States. You know, we talk about cancers, we talk about cardiovascular disease and strokes and those type of things, but actually falls are right up there. So out of all the several thousand different ways that you can die, the 5th most common or 6th most common would be a fall. Usually people, the reason they die from the fall is, of course, if they directly injure their head and they get bleed in the head, which could be a fatal. The other reasons people will die from a fall is they will usually end up breaking a bone, a hip or something, and then they will end up in the hospital and then develop complications of the surgeries or the procedures, and then usually end up getting into trouble there. So let's get out of this. And every 20 minutes. But that's another interesting slide that I found, that they're saying that an adult, there are different statistics, some of them say 29 minutes, some of them say about 20 minutes, but there is a person dying in the United States every 20 to 30 minutes just because of a fall. I think we can get out of this and go to the... Click on this twice. You have to get out of this first.
Oh, yeah.
Click on this thing. We can get out of this.
Oh, there you go.
Yeah.
Maybe that's it.
So
Look at that.
So if you statistically look at the causes of the falls, the accidents or environment-related falls, they are usually about 1/3 of the causes. The gait imbalance or a personal disorder, which gives you, a problem with balance, which could be due to neurological problems or orthopedic problems, usually accounts for about 20% of the falls. And then, of course, dizziness-associated falls and vertigo-related falls also account for about another 13%. And there is a big chunk there, which are usually unknown. So a lot of times people will fall and we never figure out what's the reason for the fall. So just some tips for you. We do see people with falls in our offices. People will bring the patients to the office and they say, grandma has been falling a lot. One of the things which has been known to improve to decrease the incidence of falls is strengthening of the muscles and some type of physical therapy. So the cheapest thing that we do for patients in the office is we tell them to go to Walmart and buy 2-pound ankle weights. And then what we do is we tell them, you put these ankle weights next to your sofa when you're watching TV. And while you're sitting, you put the ankle weights on and you just lift your leg up. And you count to 1, 2, 3, 4, 5. And then you do the same thing on the other leg. And you do this 10 times, just like she's doing right there, yeah? But you don't dangle it, you hold it up. That's it, hold it up. So once you get better at it, you hold it for 10 seconds each side, and then you do sets of 10 at least twice a day. Now that exercise itself will improve the quadriceps muscle, which is extremely important in getting up, in balance, and actually it will also improve a lot of people's knee pain. So that happens. If somebody has a little bit of extra financial help, the other thing which has been shown to improve the falls is a stationary bicycle. So we don't tell people to bike outside because that will increase the chance of falling. But if you're older, we will tell you to do the stationary bicycle. Now the better ones are the ones which you have reclining chair. So you can lie back and you can paddle the bikes. We tell them to put it on a high resistance so that they're not paddling fast, they're paddling slowly but against resistance. That exercise will improve the thigh muscles, the hip muscles, and the leg muscles. So basically improves strength in the legs and will decrease the incidence of falls. They've done a lot of research on how to prevent falls, and one other cheap way, which I have not suggested to people, but it seems to be quite effective, is there's a set of exercises which are available, which are called Tai Chi. So Chinese or Asian-based exercises, they have shown to be statistically improve the incidence of falls. So these are some very, very simple methods through which the falls can be prevented in elderly population. Just very, very simple methods. Let's get out of this and go to folder 1. We are missing Debbie.
Mary Alice did that. Can I get a vote?
These are not mine. So folder 1, right here.
Oh, folder 1. Oh, now we know. Okay, now we're missing Debbie, but we got this.
I'm pretty confident, and then what we want to do is, okay, excellent, and scroll it down a little. So I'm pretty sure that the hospitals and the nursing homes or any type of facilities they're probably required to keep some type of record or some kind of assessment that you guys have to do after a person falls. I found this to be pretty interesting. This is a post-fall evaluation form, which is done at a particular place, and I just pulled it off, but it had very interesting questions. So basically, you're wanting to know if the person injury was serious. Did he lose consciousness before falling, or did he lose consciousness after the fall? And one other thing is you want to always ask the patient if they know why they fell. We always, in the office, sometimes try to reproduce the scenario where we will ask the person to describe to us what exactly happened and how did they remember their fall. Also, of course, were they alone at the time that they fell? You always want to know if somebody's medications have been changed recently. So medications are a very common cause of increasing the incidence of falls. The commonest medication which usually do that are the ones which are affecting the brain. So sleeping pills are right on the top of the list. The antipsychotics, they are right up there. And the antidepressants are also right up there. The pain medications, when you're using narcotics, also will increase the incidence of falls in the independently. You want to look at the lightning situation where the fall occurred. That's a common cause. Not enough lightning in the house or in the environment where the person falls. Was there any glare? Of course, you guys make sure that you don't have uneven or slippery floors. In people's houses, they have a lot of wires around. They will have, carpets which are bent over and basically creating a hurdle and increasing the incidence of the falls. Does the person use any type of assistive devices, which includes canes or walkers, and have they been using those while they fell, and are those devices fitting properly? Also the footwear. Does the person have socks which have any grip? Or they're wearing inappropriate shoes, which may have led to that? You can go down. The other reason people will fall is poor vision. So if they don't have properly fitted glasses, or if they haven't had their cataracts fixed, or for other reason they have poor vision, that would be another reason to fall. Most of the facilities like this, I think they're equipped quite well in the bathrooms, where the floor could be a little slippery. I think you guys have handles in the shower place and handles while getting up from the toilet seats. So that also helps the situation significantly. So we can get out of this. So when you see somebody falling, now let's get back to what we really need to discuss. So when you see somebody fell in the room and you go there, the thing that you're trying to figure out immediately is, did this person hit their head, or was the head not injured? So if the head was injured, it's a different protocol that you follow. If there was no injury to the head, that is a different protocol. So let's go over first of all, there was no injury to the head. So as soon as you walk into the room, the first thing that you want to make sure is the airway intact? Is there some reason that the person is not breathing? The second thing you want to do is quickly check the pulse, make sure they have a heartbeat. So once you've evaluated those two things, you also want to call for help, because it's not a good idea to try to handle somebody who is on the floor by yourself. If you can get an extra person to help you out, that's a good idea. Once you've done the airway and you check the pulse and you've got some help, you want to assure the patient. And the mistake that people usually make is they immediately try to move them. So what they say is, you should leave the person where they are, and the other thing you need to do is confirm that the neck has not been injured. Because if the person has neck injury and you try to move them around too much, you could actually cause more damage. How do you check for the neck injury? How do you see if the person's neck was injured or not? If they're able to follow the commands, then what you do is just ask them to do 4 simple things. Can you look up? Can you look down? Can you look towards the right and the left? Now, if they're able to do that without really complaining about any strong pain, it usually means that there is no significant neck injury. And once you establish that there is no significant neck injury, then the other thing you want to do is check out the extremities quickly. So if there's an obvious sign of bleed or tear, you want to initiate your first aid protocol and try to stop the bleeding. Once you know there is no active bleeding, then the other thing you would want to do is check if they've broken a bone, if they've fractured something. Now, the easiest 3-4 things you can do to check for that, the commonest place which people break the bone is your wrist or the radius. So if a person is able to move the hand back and forth, it would usually mean that they don't have any significant injury there. If they're able to bend the elbow, move the shoulder, you've unlikely broken anything in the humerus. The other common place where they will fracture, the other common place that gets fractured would be their hip. So if a person is able to bend the leg like this and able to rotate it out and in, that usually means that they have not broken their hip bone. Knees, usually you don't fracture too much, but while you're asking them to bend the hip, you'll also immediately check for the knee too, if they have any significant pain there. So once you check the air rate, evaluated the pulse, called for help, looked at their neck, finally you're able to help them either to move to a chair or to a bed. Then what you want to do is, if the person is diabetic, you always want to get a sugar checked. If they're complaining about a pain in any particular joint or area which is significant, then of course you want to get some type of picture to evaluate for the fracture. So this is for somebody who did not hit their head. So now if you go into a room and you obviously, the patient is able to tell you they hit their head, or you saw them hitting the head, or there is blood coming out of the head, you know they've had a head injury. So the head injury, you're going to follow the similar protocols, but you're supposed to do a Glasgow coma scale. Do you guys do that at all? Are you aware of that at all? Glasgow coma scale. Okay. The Glasgow coma scale, if you show me one of the slides.
Slide 2?
Yeah.
Hold 2.
Or maybe 3.
Or maybe 3.
Well, let me just put one of them. Yeah, this one here. So I was riding a bicycle last year and I had a fall and I banged my head. So my brother was there and he did this on me. Later on when I went home, he said, well, your Glasgow coma scale was 14, so I think you're going to be fine. You don't need to worry. So if you look at it, it's very, very easy. The eye-opening response, if a person has got his eyes open spontaneously, or did you have to talk to them to keep their eyes open, or do you have to inflict pain for them to open their eyes? So I was personally able to open my eyes without any issues, so I got a 4 on top. Then, when you're talking to the person, do they appear to be alert and oriented to time, place, and person? Or are they completely confused? Or, of course, no response. So I was able to get 5 on that too. But then, the best motor response is basically when they are able to, actually, I'm sorry, I wasn't able to get that. I was confused. So I got 4 on that. Yeah, I just didn't know where I was, and it took me a while to figure out where I was. So I was confused initially. And then the motor response is if you talk to them and they're able to move their arms and legs, that's a 6. So if somebody over less than 8, usually they're comatose. But if you have somebody with a response of about 13 to 14, usually they have good prognosis. Last time, when I was here, a couple of weeks ago, we had discussed the subdural hematomas, epidural hematomas, and subretinoid hemorrhages and the bleeds in the brain. So when somebody is falling and hitting their head, those are the things that you're really looking for. You want to make sure that the person hasn't had one of those. The symptoms of bleed in the head, I think I mentioned it very clearly last time, sometimes it would not happen initially when you're seeing a person. They will actually happen day after, or they can even happen after 2 or 3 days. And that's one of the reasons a person with a head injury needs to get the neuro exams done. Some places have the protocols at 72 hours. Some protocols will go up to 24 hours. How do you guys do it here? The neuro checks after a fall with a head injury. 3 days? Yeah, 72 hours. Okay. So they'll pick up most of the bleeds. Now, the symptoms that will tell you that a person has had something serious, some type of serious bleed, are if a person complains of excessive headache afterwards, if a person is confused after the fall and remains confused for a while, if a person starts throwing up after the fall and head injury, if a person is unable to maintain their balance after the head injury, if their speech is goggled or slurred, or if now they start seeing things which are double. So if you have any of those symptoms and a person had a fall and hit their head, that usually would require some type of imaging to be performed. Now you can look at a person when they hit their head and even figure out even figure out while they fell if they're at a higher risk of these problems. And the people that are at higher risk for these problems are the ones who are using blood thinners, which would include medications like Plavix, Coumadin, Xarelto, Eliquis, and so forth, Prodexa. So if somebody is taking those type of medications, then their chances of having a bleed in the head is going to be much higher than a normal person. If a person is a known alcoholic, they were in the hospital for that and now they came here, if they fall, there's a higher chance that they could bleed. Now, once you've done this, of course you still want to check their sugar if they're diabetic. Hypoglycemia is a very common cause, or severe hyperglycemia is a common cause for falls. Once you've done that, usually with a head injury, you do want to do an EKG on them to assess their heart rhythm. And then if you have any of those symptoms that I discussed about, you want to get a CAT scan or imaging done of the head. And of course, any joint which hurts really bad, you want to get an x-ray of that to make sure that they don't have any fractures. Now, some words of wisdom on neuro exams. So what's the neuro exams that a complete neurological examination can take half an hour. So there are short versions of the neuro exams. How do you guys do neuro exams here? What does that include? So once somebody orders and says, we need to do a neuro exams on this patient, for the next 72 hours, what do you guys really do? Okay.
Balance, range of motion. We're going to do balance, sensation, range of motion, active range of motion.
So one of the things that you do in the neuro exam is mental status evaluation. That's the first one. And the mental status evaluation would include orientation to time, place, person. Are they talking to you and making sense? So that's one thing. So after the mental status exam, usually you want to do cranial nerves. Now the cranial nerves are the nerves which come out of the brain and they control mostly organs and muscles in the face and the head region. So those are the cranial nerves. So the first one is the ophthalmic nerve, and as you said, the pupillary response. So when you're looking at the pupils, you want to see if both the pupils have equal size or not. Now, some people who've had cataract surgeries, they don't have nice, smooth, round pupils. You know, they will have pupils which are a little bit scarred. But overall, you want to make a judgment and see if they are equal. So what do? You shine a light on one of them, and what is supposed to happen? The pupil is supposed to constrict. So as soon as you're going to shine a light, the eye doesn't want too much light. So how's it going to prevent you? How's it going to protect your nerves? It constricts the pupil so that less light is going to go in. And the other thing which is supposed to happen is if you shine a light in this eye, the pupil on the other eye is also supposed to constrict. So it's supposed to have the same response. And that's a good one because a lot of people who have a bleed in the head all of a sudden will have issues with the pupillary responses. So once you've done the pupillary response in the cranial nerves, what else do you guys do to check the cranial nerves? So we did the mental status exam, which is orientation, all that, good. Now we are on to the cranial exam, a cranial nerves exam, and the first one is the pupil. What's the second one? What else do we do? So, yeah, we do that, but it's not practical to do that. I don't know if that's part of your real neuro exams down here. So, it's that smell. So when you're teaching medical students, yes, you're supposed to do that too. But in real life, that's something we usually ignore. So the other thing that you want to do is you want to check out the third nerve, the sixth nerve, and the fourth nerve. And what it is a simple thing. You ask them to look at you, you put your finger up in the front, and you move the finger to this side, the other side, up, that way, this way. So basically all four quadrangles. Now if the eye moves, both of the eyes move accordingly to, they follow your finger, that means a bunch of those nerves that I mentioned, they are intact. So when you're when you're looking at the eyes, what you got to do? One is the pupillary response, and the other one is follow the finger testing. So once you're done with that, then the fifth nerve, which is the trigeminal nerve, is usually involved with clenching the jaw muscles. So basically, you can ask them to clench your jaw. You can put your fingers around here and you can see they're able to clench their jaw properly. The seventh nerve is basically involved with facial expressions. So you ask a person, can you give me a smile? If they smile, they don't want to smile, they're grumpy, ask them to show you their teeth. So they have to do that. And then of course, shut down the eyes tight. And if they shut down the eyes tight, yeah, you can try to open them, you will see. Or putting frowns on the head. So that also, so these are the facial nerve, the seventh nerve muscles. Once you've done that, shrugging the shoulder. So that's the accessory nerve, the 11th nerve. And put your tongue out. If you do poke them a little bit with the, what do you call it, create a gag reflex, that also checks out your vagus nerve, the 10th nerve. So let's go through the neurological exam again. Mental status, which involves checking the orientation. The orientation is simple. You can ask them, where do you think you are? What's your name? What's the day today? And which floor you're in. So if you ask them these 4 questions or 5 questions, and they're able to answer that appropriately, then it's okay. If they're not demented to begin with. So then we move on to the eye exam. And the eyes, I said, pupillary response to the light, one pupil, and then look at the other pupil to see if that one constricts. And then finger test. Just ask them to follow your finger, and if they're able to do that or not. And then I went through some other couple of cranial nerves, a smile, shrugging the shoulders, frowns, and clenching your jaw. So once you've done some of these cranial nerves, then comes the other part of the neurological exam, which is actually very important, which is coordination. So the coordination is very sensitive to check for strokes. So some basic coordination tests would include, the first one is finger to nose test. So you put your finger out like this, and you ask me to touch my nose, and then touch the finger. And then say, do it fast. One hand first, and then second hand after that. If they're able to reasonably do that, their coordination is good. People with strokes usually lose coordination. So if there's any bleed in the head, most likely this would be impaired. The other coordination test is ask them to put both the hands up like this and ask them to rapidly move the finger back and forth, touching this movement right here. You show it to them and they do it. So this is another coordination test. The other coordination test which the EMS people use to check for strokes is they ask you to put both arms out like this and then close the eyes. And if your arm falls down, if the patient is unable to hold the arm up, that means their coordination is poor. So you've done the mental exam, you've done the cranial nerve exam, and then some neurological exam to do the coordination. And then of course, there are some basic things like reflexes. So do you guys do that?
Okay, I'll be good.
Is that part of your neuro exam here? So reflexes. So knee reflexes usually are the ones which are done most commonly. Sensory exam is also supposed to be part of this. It can be made very easy. What you do is you take a Q-tip, a wooden Q-tip, break the edge off, and ask the person to close their eyes, and then you can gently rub at the same places at different time and ask them if the sensation is same. So you can do it on the face, on the forehead, on the arms, on the hand, and then down the legs. And ask them, and you rub it at with the same consistency, and you ask them if the sensation is exactly the same. And for the most part, it should be the same. So that's really a neurological exam, which you should be doing for 72 hours. And of course, if there's any problem with the neurological exam, you have to you always want to inform the physician whenever a person has had a fall. So I think that's protocol. And then again, if you notice any changes in the neurological exam, you're supposed to inform the supervisor again. Any questions? Good? Thank you.